Hey connectors, I just wanted to give you a heads up that right at the beginning of this episode, there's a little bit of distortion on Dr. Grove's voice. Just know that it clears up in less than a minute. After that introduction, it is totally up to our normal quality standards. We just had a little bit of an issue with the microphone. Sorry for that, but just know it clears up in less than a minute right after the intro. Thanks so much. Enjoy the show.
You float like a slow pen. Look on, no hands. Look on, no frame, no shame. Numb me up like cocaine. Can't focus, shake again. Which moment makes a man? 'Cause I'm hoping it just begins.
Welcome. I'm Dr. Robert Groves, your host for the Groves Connection podcast. The Groves Connection brings you intimate conversations with pundits, providers, patients, leaders, and laypeople, all to help us understand a contradiction. How can our healthcare system be both magnificent and yet so deeply flawed? We're going inside healthcare to talk candidly with those who know. What they have to say may delight, surprise, frustrate, or at times even anger you. But I invite you to get curious and listen to the truth about healthcare and those who want to fix it. Maybe the answers have been there all along. We just need to make the connection. Are you ready to connect? Dr. Robert Pearl, welcome back to the Groves Connection.
It's great to be here, Robert. I can't wait to have our conversation today.
Yeah, I've been looking forward to this ever since I learned that you're coming out with a new book. And give us that title real quick.
So it's ChatGPT MD, how AI-empowered patients and doctors can take back control of American medicine.
Robbie, you've been optimistic about large language models and how this can transform medicine and, as you say, allow providers to take back control and patients to take back control of American medicine. Can you give me a brief history of how did this book come to be? What was the idea and how did you do it?
Because as you know, I've been very positive, optimistic about the role that generative AI can play to provide simultaneously superior quality, convenient access, and affordability. This is the holy grail of medicine.
Yeah.
But I also recognize that the advancements in the power of generative AI, and I use ChatGPT just as a cute name for all of the applications. It's not the specific product of OpenAI. That it was advancing so fast, doubling every year in power. That means that over 5 years, it'll be 30 times more powerful. And the human mind can't understand how fast exponential growth happens. You may remember back in the COVID pandemic, we talked about how if a pond is going to be fully covered with water lilies that double every night.
Yes.
After 50 days, it's fully covered. At day 49, it's half covered. Day 48, a quarter covered. Day 47, only a little green here and there. You don't recognize that very quickly this change is going to occur. So I knew that the regular publishing process couldn't possibly capture this speed. It's 2 years. In fact, between finishing a book and having it published, it's usually 8 to 10 months.
Yeah.
Powerful, twice as reliable.
So how do you possibly speed that up? I mean, what do you do to make it go faster?
First of all, I made ChatGPT, I'll say my co-author.
Oh, wow.
I took the 1.2 million words that I have published and downloaded it into the application. And then through a series of literally thousands of back and forth communications, the way you and I might write a book together, used it to create the manuscript.
Wow.
Now, there is one chapter that I included that ChatGPT wrote alone.
Oh, yeah.
And there's a moderate number of chapters that I wrote predominantly by myself, but most of the chapters were this back and forth, trying to explain to people, first of all, what makes it so different than all other AI or anything else that came before, and to understand the power of going forward.
Gotcha.
You can go all the way back to Gutenberg Gutenberg had the printing press. All of a sudden, rather than books being as valuable as gold and only the very wealthy became more broadly available.
Right.
And then it leads to universities and to libraries. You look at the internet, developed first by the Army for communication amongst different sites. Should Russia attack us in the 1960s or maybe into the 70s, the Cold War era? Get knowledge available. Even the iPhone gives you knowledge, the computer.
Yeah.
This is going to give expertise. It's the ability of the patient to be able to use technology to do, and I'm going to estimate 20% of what doctors do today. And that is revolutionary. When I wrote the book, I thought I was being overly optimistic.
Yeah.
Last week, NVIDIA announced that it would be creating a nurse AI chatbot that would be able to advise patients about medications, to be able to explain what the physician was telling the patient relative to their condition, would help them manage chronic disease. As I said earlier, with this exponential growth, I think I may be overly conservative about how powerful this new technology will be for American medicine.
You know, Robbie, I've been out talking to folks about AI for a couple of years now, and I don't see this level of optimism in very many places. I do see it, but there's still this conservative bent in healthcare where they're wait and see. What about cybersecurity? I mean, how do you see all that playing out?
You're absolutely right, because there are two ways to look at a technology that is both this powerful and evolving so fast. And I should add before we go on that all the profits from this book go to Doctors Without Borders.
Yes.
And it's going to be available on Amazon. Actually, you can go there now and order the ebook if people buy the hardcover book or the ebook on the launch day, which is Tuesday, April the 9th. Not only will Doctors Without Borders get any profits, but I'll also be making a personal added donation to recognize the people who buy it on that first day.
Thank you so much, Robbie. That's generous.
Well, I've done it for all my books. I just believe in this charity so strongly. And this is not about making money. This is about education, something that I've been valuing my entire career. But going back to the questions you posed, there's two ways to look at any exponentially improving technology. You can look at what exists today and say, oh my gosh, this could never work. Look, it hallucinates and the security and privacy.
Yeah.
And that's all true. And I don't recommend this technology today for someone to obtain medical care without human assistance.
Gotcha.
So if you look at where we are today, you can say pessimistically, look at all the problems. You look ahead 5 years, you can say, oh my gosh, I can't imagine that all these things could be accomplished. We actually could raise quality, save hundreds of thousands of lives from misdiagnoses, from medical errors, from complications like heart attacks, strokes, and cancer from chronic disease. We have this massive opportunity to take a completely broken healthcare system and transform it. And the reason is that unlike those other things that I mentioned, the printing press and the internet, this actually provides expertise, not just to clinicians, also to patients.
Yeah. Somebody I think said that this is the internet democratized knowledge and AI is going to democratize thinking, which is an interesting way of putting it. So where do you see, how is this transformation going to happen? Where do you see inroads being made first in the healthcare industry?
It's remarkable to me how many people, and I mean almost daily, someone writing to me, usually a clinician, who says, Robbie, you're coming out with this book on generative AI. Are you aware of what it can do? And of course, I think I'm aware of a lot of the things. And I say, well, what do you mean? And they'll say back to me, or they'll write back to me, I put all this data in for as though I was a patient with diabetes, maybe a family history of heart disease, taking 3 medications. It gave me information that was so clear and powerful so accurate.
Whoa.
Even if I had to use today's version, it would be positive.
Yep.
2 years from now, when it's 4 times as effective,
Yeah.
when it becomes more reliable, this is going to be the tool that patients go to first when they want to get information, when they need the expertise, when they need to decide, it's the evening, your child has 102 fever. What do? Do you go to the ER, wait an hour, be surrounded?
Yes.
Do you wait till the morning? Maybe something really terrible. Do you call your mom? What do you do? Now you'll have ChatGPT or another generative AI tool able to give you that information, but you've got to learn. And I've read some estimates that it takes around 10 hours of practice. How to put information into it, because the more it knows about both your medical history and about you as an individual or as a parent, the better it can give you the answers that you need. Again, stressing, not today to replace physicians, but to be able tomorrow to accomplish the same thing. But I also want to stress, and I have the highest respect for physicians, for doctors, for clinicians, for nurses,
Right.
but we make mistakes.
Yes.
And we often ignore the mistakes that we made. 400,000 misdiagnoses a year, 250,000 medical errors. Diabetes controlled less than half of the time. Hypertension controlled maybe 55 to 60% of the time. The opportunities are vast. And we need to mindset-wise think about, not is this technology perfect, but is it better or worse than we have today? And I'm absolutely confident that it will be much better than we have today. And the technology plus the clinician, and I want to add with leadership, I'm sure we'll come back to this later on,
Yep.
will be dramatically better than anything that currently exists or anything that a single human can independently do. That is the history of technology, and this will be even more so because of how powerful the generative AI engine is compared, as you said, to other AI. Will we have to overcome issues of privacy and security? Yes, but will it be any worse than going on your computer right now, clicking on some links, and risking the possibility we just saw with the Change Healthcare scandal?
Yeah.
Ransomware people can bring down an entire electronic healthcare system. The EHR is certainly prey for people who want to do this with all the information it has. So this is not looking again at perfection versus nothing. This is asking, how does it compare to what we have now? My biggest concern are the hallucinations.
Yeah.
I think much of that will get improved across time. And I also think that much of the tools of being able to use this for broader applications, these are what's called plugins, GPTs is what they're officially labeled, that allow us to take a lot of information, let's say from wearable devices, put it into the system seamlessly. And I don't mean really plugging it in, it's done through Bluetooth.
Right.
And now be able to know, how are we doing? How's our chronic disease happening? Are we doing the preventive things that we need? How do we improve lifestyle medicine? These are opportunities that are now coming onto the stage that didn't even exist 12 months ago. And we have quite a number of products that now have memory.
Yes.
When I wrote this book, I said I put 1.2 million words. I didn't do it once. I do it lots of times. The technology keeps forgetting it. That was 6 months ago.
Oh my gosh. Yeah.
Knowing I could have written this book twice as fast with the technology that's about to be available.
That's fascinating. Robbie, I have, we've all heard and talked and discussed the dangers of AI. One of the concerns that I have, and maybe you can put my mind at ease here. You gave me some great information. I remember when we talked last time about the misappropriation of funds in healthcare, and my point was it's somebody's job, and you said to me something that's resonated with me ever since. It's like an inefficient process, is not sustainable. And so, yes, it may be somebody's job, but somebody's going to take jobs that are efficient and that do deliver. And I didn't say it as eloquently as you did, but it stuck with me. So I'm going to ask you another question now because I want your opinion. One of my concerns is that we develop this technology and it makes the physician encounter far more efficient. And instead of saying, you know what, relationships are important, we're human beings, we need to connect. The most powerful influence is a trusting relationship with a caregiver. How do we prevent taking this technology and saying, well, you used to see 20 patients a day, now you can see 40? Instead of using it to give back to the relationship that human beings thrive on, using it to just simply increase efficiency. Is it the payment system? How do we avoid that?
You're raising a crucial point. And in the book, ChatGPT MD, I emphasize that any technology that does one of two things, slows clinicians down or erodes their income, isn't going to be able to have the impact that it should.
Yeah.
And it's not because clinicians are in any way negative. They're just human beings.
Yes.
They've got families to support. They go home at night. They want to feel like they've done a good job. They're very dedicated. They're committed. It's all the positive stuff. It's just the reality of the fact that in addition to being a mission, medicine is also a job. It's also a livelihood.
Yes.
And I point out that leadership is going to be essential because we have to evolve from a fee-for-service system to a prepaid system. I like to call it capitation, a single payment to take care of a population of patients with your rewards based upon how healthy you can keep people.
Yep.
In 1932, the CCMC, the Committee on the Cost of Medical Care, talked about a movement from fragmentation to integration, groups of clinicians working together as one, combined with a shift in payment from paying for volume to paying for value, reimbursing the more you do, even, by the way, if it does no good, or even if it has a complication, you get paid twice to something that is going to be based upon keeping people healthy, avoiding disease, preventing complications. Why have we not gone there in almost 100 years?
Yeah.
This progress that we know is essential. And I think the risk has been too great because you can't take that risk, that financial risk, unless you have a means of being able to improve that health and quality.
Yes.
I talk to clinicians. They're concerned because patients don't always follow their advice.
Yeah.
60% of Americans have chronic disease. We know how to prevent it often, but it requires lifestyle changes, requires preventive services and other things that are necessary that aren't always happen. We now have that tool. And that's what's so different right now.
Okay.
Why is it that clinicians are getting burned out? One reason is that work has just escalated. And why is that? Chronic disease.
Yep.
You have appendicitis, I take out your appendix. Once you're healed, we're done.
Yep.
With diabetes, we're now seeing you 3 to 4 times a year for the rest of your life. That's a totally different workload. And so what I would say is the idea of seeing 20 patients or 25 or 30 patients, no, we want to see 10 patients.
Yes.
But we want to compare to a lot more patients. But we don't have time to do that. But that's where ChatGPT is able to do. Imagine chronic disease. You have diabetes, hypertension. I see you in the office. I say, I'll see you back in 3 to 4 months. In between, nothing happens. I don't know how you're doing. You don't know how you're doing. Now, all of a sudden, with wearable devices and other monitors, every day you can find out how you're doing. If your hypertension isn't getting better fast enough, you need a medication change. I can change your medication and quickly bring you into control. We know this can happen in integrated medical systems. In Kaiser Permanente, we reach 90% hypertension control. The rest of the world is 55%. Not because we have better doctors. Everyone has great doctors. We had the technology to accomplish that. ChatGPT allows that to be everywhere. Diabetes leading to kidney failure. Diabetes leading to amputations of extremities and blindness. Poorly controlled in the United States today. Generative AI can help patients to be able to monitor that, to change their diet, to get the exercise. It's not going to be perfect because it still requires a motivated patient, but I think as clinicians, we underestimate what patients can do And I think we underestimated it because we didn't have the tool to give that expertise. That is what's changed. And now when we shift to a capitated system instead of a fee-for-service, now actually 20% of what we're doing in the office today can be done by the patient. We can generate a lot more income, not by doing a lot of tests and procedures, but by keeping people healthy, by avoiding those misdiagnoses, those medical errors. Imagine how positive it would be if we dropped healthcare costs by 10 or 20 or 30%, not because we cut down on people unnecessarily or improperly or through private equity or all the other ways that it's happening today, but no. The data says that 30 to 40% of these life-threatening, very expensive conditions can be completely avoided through good preventive care, through better management of chronic disease. We just don't do it well. ChatGPT creates that. Now, will it require leadership? Sure. You can't do this alone as a single doctor. You got to bring a bunch of physicians together or clinicians together to accomplish this. And they need to be willing to be able to accept the risk that they're going to benefit the most when they keep patients healthy. A lot of other, I'll say, cautions out there. You need reinsurance for the unexpected heart transplant and other things like that. But these are economic possibilities that can be well managed with good leadership. The hardest part is getting everyone aligned for the same common purpose.
There are two topics that you triggered in my head just now. And one of them is I've become very enamored of what Sami Inkinen, I think, at Verta Health coined continuous remote care. And as you know, they've been very successful, and they have a strategy that literally is, you have biometrics at home that are shared with your healthcare team. Now, it's still very human intensive today because they have a coach that's looking at all this, et cetera. ChatGPT can take that to a new level and really put continuous remote care on steroids. And the key is, as you just mentioned, is as a patient, I want to be able to ask a question when the question comes up, not in 2 months when I have an appointment with my doctor. And, it's impossible to call in and get that question answered in time manner, nor do I want to bother my doctor, when he's trying to do all the other things he does.
When I look at this NVIDIA, they call it a nurse AI chatbot. You can call it what you want to do. It's providing medical expertise and advice. It's helping you manage your chronic disease. You can go online and look at the videos that exist. It is actually answering the clinical questions that you want to know. And the cost, $9 an hour.
Wow.
Now, why that's so important is with a resource, and I'm going to say that is that good, although it has not yet been released, so I don't know that it is, but assuming that it fulfills the predictions and information that it's touting, you can do a lot. You can have a lot of interactions at $9 an hour that you can't have at $150 an hour. And so that becomes the shift that occurs. You mentioned the fact that it requires, as you say, a human being at the other end of the data information. And no one's really wanted that, or if they wanted it, they wanted to charge a lot to make it happen. Now it's automatic. Hospital at home is a great example to me. Probably 20, 30% of people admitted to a hospital could be very well better managed at home than in a hospital.
Right.
Why is that? Because they'd sleep at night. They'd be surrounded by loved ones. They'd eat well. There's a lot of reasons why. They'd avoid the medical errors. 1 in 4 patients in a hospital experience an untoward event from a misdiagnosis or a medical error. All the things that happen because hospitals are not designed for relatively healthy people.
Yeah.
They're designed for the really intense sick patients. But why have we not kept people at home? It's just straight mathematics. In a hospital, nurse staff ratios are about 4 relatively healthy patients for 1 RN. They can't do 1-to-1 in the home. But ChatGPT solves that problem because they can do the continuous monitoring and they can link into a telemedicine-driven service only when you have a problem that needs taken care of. And at $9 an hour, we can give you a massive amount of care that otherwise, even better than what you'd get in the hospital as a relatively healthy person. If you need an ICU or you have a lot of risk of a major complications, you need to be in an inpatient facility.
Yes.
Let's say with a mild pneumonia, home would be a better place to take care of them. And the cost now starts to become affordable. So that's the opportunities, and they're already here. Now, if we had too many clinicians, doctors and nurses, I'd be worried about the jobs. But we don't.
Yeah.
We have way too few. We lost 71,000 doctors last year out of healthcare. We know that nurses have a high probability, they've discussed in research surveys, of wanting to leave medicine. We have trouble staffing.
Yeah.
And the pipeline takes so long. We're not going to solve this. And how are we solving it now? We're making people just get on a treadmill and run faster and faster every single day.
Yep.
Usually not because, I'm sure there are exceptions, people have a negative streak inside them. There's just no alternative. We have the patients, we've got to provide the care. So yesterday you had 10 inpatients, then today's 12, tomorrow's 14, and so on. Just to meet the needs, we now have this alternative. So I'm not as worried as you are or as your question implied, I know you're not as worried about this overwhelming, increasing demand if we can shift the economics that sit underneath it all.
I haven't heard you talk much about using AI to address the administrative burden in healthcare. Is that something you've thought about or investigated?
Sure, there's a lot of ways that AI can help administrative burdens. In fact, it's already doing it. I think over the past year, we started to see quite a number, and that's not quite administrative burdens, but documentation, computer burdens.
Yes.
Using AI to be able to listen in on conversations and generate the notes for clinicians. We know that it can also help clinicians to be able to submit billing and claims requests. It can certainly be used administratively at hospitals to reduce the overhead, I'll call it, on care delivery. But what I want to stress is that I believe that increasingly the problem is not the technology or lack thereof, but it's human beings standing in the way. I don't know that hospitals want fewer administrators.
Yeah.
If they wanted fewer administrators, they probably could come up with a system to do it. But I think that in the mindset, they like having more administrators.
Yeah.
So I think we have a human problem. And again, why I go back to this notion of moving from fee-for-service to capitation.
Yeah.
Because as long as it's on a fee-for-service basis, more people generating more need for care, generating more bills, generating more coding improvements, just keeps generating revenue. So in their mind, more administrators actually a revenue source.
Yeah.
But in reality, it's actually a cost.
Yep.
It just depends upon which side you are, because the hospital system doesn't pay for the care. Paying for is going to be the patient and the employer, usually, or the patient and the government sitting in play. And there's not the same incentives until you move to a capitated system. Now, all of a sudden, it's going to look for the technology. So I think the technology in administrative areas, it's already there right now. We could be using it far more effectively.
Yeah.
But a lot of the book ChatGPT MD is really about the human side. It's letting people know what the technology can accomplish and letting them see how the current system, by the way, which is despised by both the providers of care and the recipients of care, both, by the way, around 70% think is really broken and needs fixing.
Yes.
Now we have that tool. In the book, I talk about 4 eras of healthcare. Healthcare 1.0, that was the late 20th century. All of the advances today just about happened then. CT, MRI, from a diagnostic standpoint, heart surgery with the heart-lung machine allowing us to allow patients to be able to go on bypass surgery, cancer chemotherapy. This was a golden era where we advanced medicine, medical outcomes dramatically. 2.0, that was going to be the electronic health record. It was going to have information available, interoperability. It was going to change everything, except it didn't happen.
Yeah.
Not because the technology couldn't do it. It was designed for billing and claims, for economics. So it became a burden. It became a machine between doctors and patients, not one on which they could advance it. You go forward another decade to 3.0, Now we're talking about having the same convenience in medicine that you have on Expedia when you want to book a flight or a hotel.
Yeah.
And we just didn't put it into medicine. And again, there's 2.0 and 3.0. What you see is that the EHR slowed down doctors. And what you saw in 3.0, it would have eroded income because we still had a fee-for-service system, and the more the patient could be doing, the less it would be in the office where we could bill for it. This is going to be 4.0. And will 4.0 be like 1.0 or more like 2 and 3? It will all be based upon the humans. The technology can accomplish remarkable things. And in terms of value-based care, which is sort of the buzzword,
Yeah.
value-based care is making care more affordable by increasing quality and service. In the mindset of most providers of care, quality, service, cost, pick any two. You can't have all three.
Yes. Yes.
ChatGPT is the solution. The way you make it affordable is better quality. You avoid chronic disease and its complications. The way you make it more convenient is you make it available 24/7 at a cost that people can afford. And this combination of quality and service and affordability all coming together as one, we have never had in the history of medicine, but we have today.
That sounds incredibly exciting. But I want to go now, Robbie. I know this is a passion of yours. I've heard you speak about it on many occasions. Talk to us a little bit about what's going to be required. Well, first of all, what is leadership? What's going to be required of leaders, and how will leaders need to transform themselves in order to thrive in this new environment?
So leadership, I think of as the ability to make things happen that otherwise would not. Things that once they occur, people would never go back to where they were in the past. I think of administration as doing the things that you're supposed to do. You got to pay people on time. You got to adhere to regulations. You've got to have a capital plan for long-term investment. These are the types of jobs that are essential to have a business, an industry that works.
Yeah.
Leadership is something totally different. It requires this ability to see things that don't yet exist and help people to go to that destination. And when they get there, despite the challenges of always getting there, it's never easy. But once they get there, they would say, my gosh, how did we ever survive in the past?
Yeah.
So with that as a background, well, I add two things. One is what's necessary to help people move forward are three, I'll call them in quotes, organs. You need the brain. You need to be able to let them understand what's going on. Why is their interest? What happens if they don't go? And as I'll say, smart, educated individuals, we often think the brain is the dominant organ, but it's not. It's actually the second one, which is the heart. Because people are not going to take the risks, even if they think it's a good idea, unless they believe it in their heart. This is the mission. This is the purpose of doing that. And then finally, it requires spine. Because as logical as it is, and as good as that destination could be, there's always this tendency to think we'll never get there.
Yep.
And so now you have to ask yourself, look, Robbie, you've told us now for 30 minutes at all the great things that can happen. Why wouldn't everyone just say, come on, let's go?
Yeah.
Psychologists tell us we fear loss far more than gain.
Yes.
Flip a coin, and if it's heads, you're going to get $3. If it's tails, you're going to lose $2. You may not flip the coin, even though the odds say that is 100%, that's better than Vegas.
Yeah.
And yet we often will turn that down. So what are people afraid of? Well, they're afraid that maybe it's really not such a great idea. So yeah, I could be worse off than today. It's not worth the risk. Or I fear you that as a leader, I can't trust you. And I use an A to G model. It's in the book, GPT MD. It's the fifth and final part about the role that leadership is going to play. And in the shortest of time, it's really a several-hour kind of teaching session that I would normally do in the business school. But A is for an aspirational vision. You got to touch the heart before you can touch the brain. And an aspiration is a combination of inspiration and reality. Inspiration is great, but without reality, it's a dream. And reality is good, but without inspiration, it's just work. And how do you put them together? And so the inspirational vision is, how do we make medicine more affordable, more fulfilling, not by cutting back, but by being able to improve health, avoid complications of chronic disease, minimize the need for hospitals, be able to free time up for clinicians. This is the kind of vision. It's not an easy gimme, but it is possible. And again, the book explores that in great detail. Be the behaviors. What exactly should I do? You expect me to be on call 24 hours a day, 7 days a week? That's impossible. No. I expect that 30 doctors working together would each take 1 day every month to be available and cover for their colleagues at night and weekends. And now patients don't, oh, I can do that. 1 day a month, I can do that.
Yeah.
When you think about American healthcare, you often think it's great until you look at some of the data. You know, we spend $13,500 per American today.
Well,
Switzerland spends about 10, Germany 8, everyone else is half of what we spend. And amongst the 12 industrialized nations, we're last in life expectancy, maternal mortality, childhood mortality. These are really important problems. Over half of Americans say they can't afford health care. The opportunity to be able to recognize the need for change. And by the way, the federal government just announced that healthcare costs by 2031, talking 7 years, will go up $3 trillion every year.
Ew.
$3 trillion. What can we do with $3 trillion? How would that be used in the educational system? How would it be used in the public health system, the preventive health system? How would it be used for safety? How would it be used for research? I could give 100 ways.
Yeah.
We have to be able to achieve the outcomes. So what are we going to do if after 6 months we haven't made as much progress as we think? E is the engagement of the leader. No one cares how much you know until they know how much you care. If leaders want to lead, they have to be with the people. It's not sending out emails. It's not strategic plans. It's not meeting with administrative staff. People need to know that they can trust and believe in their leaders. F is the faculty, who's going to do it with the leader. And then G is the governance, which is the formal governance, the informal governance, and the incentives. And the one thing I will tell listeners, I teach it at the business school all the time. Financial incentives always work. They always induce change, but it's never what you want or expect.
Yep, I agree with you 100%. That is absolute fact.
It's the end of the process. It's not the beginning. The beginning begins with the A, not with the G.
You know, Robbie, I love that you brought that up, because I refer to the notion that financial incentives are the only thing you need to lead as paint by numbers, and compare that to a Monet.
Yeah.
It ain't the same thing. And there is a true art in leadership. I'm not saying it can't be learned, but there's an art in it that is not just metrics. And if you rely solely on that, you're going to have a paint by numbers piece of work.
I would go a step further, because I think we've often derided, I'll use in quotes, metrics, because I don't think of them as metrics. To me, we have some things that we know are best practices. They work all the time.
Yes.
You know, we know how to manage insulin for someone with diabetes and bring it under control in a way that gets the hemoglobin A1C down to the levels that are going to prevent the complications that are inevitable.
Yep.
There are some problems that we just don't know enough about. Long COVID.
Yeah.
You can make up almost anything you want because there is no evidence-based. We don't know quite what caused it. We have a lot of theories. We don't know how to treat it. We have a lot of possibilities. That's where it's all intuitive. Or some of the diseases that exist that are going to be not well defined in medicine. And then we have an area, a smallish area in the middle. And there's a mistake by thinking that the evidence is secure enough when it's not yet secure enough. What's an example of that? Well, how tightly do you control blood sugar? And I say that because there's two sides. Control it really tightly, you could get into a car wreck.
Yeah.
Control it not entirely at all, you're going to end up with out a kidney or with a heart problem or an amputation of an extremity. These are the endpoints. But in the middle, You have to have a lot of conversations. And one of the things I stress in the book is generative AI is not going to get rid of doctors. It's just going to allow them to do the things that only they can do so effectively, and clinicians, the only things humans can do. And that is to understand the patient at a much more deeper level. And today it doesn't happen. And it's not happening because there's not enough time. Yeah, sure, if you pay enough money for a concierge clinician, you're going to get the kind of service you want, but that costs money that most families don't have. That's the opportunity, I believe, that sits there. I think the biggest mistake is to think, though, that you can use the money to make it happen, to make the right things happen. And why I say that is that there are way too many improvements that could occur. And no clinician can handle all of them in the time that's available. And so we put money behind blood pressure control, and we get better blood pressure control, but now we get a lot more cancer because we didn't incent that. So now we incent cancer, and what we end up with is kids with asthma having problems breathing and developing chronic lung disease from smoking and later on because we didn't incent that. So the incentives will change the performance, but they will not do what we want to do. This is about maximizing health, improving the lives of people. And to me, that is the mission and the purpose of medicine. And we've lost that view.
I really appreciate your clarity of thought and the fact that you were very straightforward, very frank. You proved that in Uncaring. You're brave enough to say what's really at the root of many of the problems that we have. And I do appreciate that. What would you tell the practicing doc or nurse today about how to prepare for this future? Is there something that they should do or be doing to prepare for this coming wave of technology?
Absolutely. This is the time to learn about it. And what people will find is that until you've used it a significant amount of time, and as I said, some of the data says the minimum is 10 hours. It's a little bit like the 10,000 hour rule that you keep hearing about. It's not an exact number. A year from now or 2 years from now, there'll be books about how to do all the prompting. But what you tell the machine, the application, I'm a non-compliant patient with diabetes. What advice do you have for me? With a family history of heart disease, now what do you have? The answer you gave me might work for my college-educated PhD patients, but now they have a 6th grade education. Now what are you going to say? How do you write it in Spanish? How do you create it in a way that's going to have a higher probability if people look at it every single day? It's building that experience. Literally, I did thousands of prompts to generative AI in the writing of the book ChatGPT MD. Each time having to refine it, to move it, to change it. That's the experience. Same thing, by the way, with patients. Don't use it as the answer yet, but pretend that you are. Take your symptoms and put it into the application, get the diagnosis, ask about the treatment, then talk to a doctor today before you actually do those things, but learn how to do it better. And it's like any other tool. If all I hand someone to is a smartphone, they'll probably be able to make a telephone call because they knew how to dial a phone in the past.
Right.
Will they use it to get to the internet? Will they figure out how to use it to accomplish access to retail, to compare price? No, they will not do any of those things until they practice with it. And this is no different. Whether they choose to use the generative AI tool from OpenAI, the one from Google, the one from other sources, there are a lot of opportunities. I don't think we yet know which one is going to be, in quotes, the best. It's probably going to be some combination, but without any doubt, what you go in, the more detail you present, provide the application with all of the patient's laboratory results, with all of their medications, with everything about their family history, and you will get a far better answer, much more specific. I mean, think about it. How many of your clinicians are aware of your genetic history, of your human genome, assuming it's been sequenced? Isn't that important? Isn't genetics a major part of our care?
Yes.
And
Yes.
why do we not have that? Because it's too complex, it's too big.
Yeah.
For ChatGPT, it's easy to do. Now, right now, in medical school, we spend a lot of time teaching doctors about the doctor-patient relationship. Now we have to be teaching patients about both the patient-technology relationship and about the patient-clinician relationship in the context of technology.
Robbie, this has been a great conversation. I cannot wait to get my hands on the book. I'm really looking forward to it. The last question I'm going to ask you, and I won't promise that, but I think the last question I'm going to ask you is, if you were today to predict how far along the path we'll be in 5 years, what would you say?
In 5 years, no one will be practicing medicine without a continual reliance on a generative AI tool. And patients will go there first, unless they're having a life-threatening problem, to at least understand what's going on, and whether that solves the problem for them, whether it takes them to a resource that can solve it for them, or whether it just educates them and provides expertise before they see their clinician or go to their local hospital. That I can't be sure how it's going to play through. All that's standing in the way, as far as I'm concerned, are humans, not the technology. The technology will evolve at that pace. Will we create the systems that is going to allow patients to be able to get care in a capitated, not a fee-for-service way? Are we going to create a system that's going to allow clinicians to get rewarded for doing what patients want, keeping them healthy and avoiding the problems in the first place? I don't know anyone who would like to have a heart attack and have it reversed rather than not having the heart attack in the first place. Everything we're talking about is something that's going to be moving forward. And I'll offer the warning, at least to the clinicians listening in, that if we don't lead the way, someone else will. And the people who will, I believe, will be the retail giants.
Yep.
It's going to be the Amazons, the CVS, the Walmart. They're already coming into the healthcare space. They're focused on a capitated system of care. They're technologically very sophisticated. And as I mentioned earlier, this entry of NVIDIA, the leading high-end, high-speed computer chip manufacturer that has now joined companies like Apple and Amazon and Google and being one of the big 7.
Yes.
So I don't know who's going to lead it. I hope it's going to be the clinicians. I think doctors and nurses will be far better at figuring out how to use this technology. But they have to be willing to allow medicine to evolve and be transformed. They have to be willing to accept and see the problems that exist today. But if not, as I say, it will happen. That is no question in my mind. And 5 years from now, certainly by 10 years from now, medicine will be very different than it is today, and generative AI will be at the center of it. And the same, by the way, is going to be true for almost everything in American life.
Ladies and gentlemen, Dr. Robert Pearl, you've just heard from the man who has looked into this probably as much as anyone else in the country. The book is coming out next week, as this is broadcast in early April. And get your hands on it. This is going to be transformational. And if you want a head start on what's happening in AI and healthcare, and you want to read a book that was co-written by ChatGPT, the opportunity is there. And I know that I'm going to get a copy on the day it's released. ChatGPT MD, and follow along the transformation of American healthcare. Dr. Pearl, it is such a pleasure to have you on again. Thank you so much for coming.
My pleasure. And people want more information, go to the website, robertpearlmd.com. As you say, ChatGPT MD will be available on Amazon. Well, it's already available now for the ebook. People would obtain the hard copy on the 9th of April. And all profits go to Doctors Without Borders, with an added donation for any listeners who buy the book on the first day it's available, next Tuesday, April the 9th. Thank you so much, Robert. It's been a pleasure to be with you today.
Thanks, and we're out for the Groves Connection.
You've been listening to The Groves Connection, your connection to the inside story on healthcare, featuring in-depth interviews with those who know. You can find us on Apple Podcasts, Spotify, and anywhere else you get your podcasts. If you like what you hear, give us a 5-star review to keep the connection going, and hit the subscribe button to be sure you never miss a beat. The Groves Connection is produced by Dr. Robert Groves. Original music, editing, and creative direction provided by Alden Groves. Production support, content guidance, courtesy of Janae Sharp and Elizabeth Barrett. Thank you for listening. The professional ideas and opinions expressed in this podcast are mine and do not reflect those of any current or past employers. Thank you so much for listening, and we hope you'll join us next time on the Groves Connection.